The medical secrets of the world will be revealed in this episode of Optimal Anesthesia, so please join us. The use of transdermal patches in anesthetics is explored in detail today. Let's start by going back in time. Transdermal patches are a relatively new medical innovation that had its origins in the 20th century and reached a watershed moment in their development in the 1970s. In 1979, the first transdermal patch became available. It was an anti-motion sickness scopolamine patch. Take this with you and you'll be able to travel without becoming sick. Today, these patches have proven indispensable in a wide range of medical settings, particularly during anesthesia. Have you ever wondered what's under that little patch you slap onto your skin? Well, there's more to it than meets the eye. Absolutely. Each transdermal patch used in anesthesia is like a multi-layered cake, with each layer playing a vital role. First, we have the backing layer. It's like the superhero cape, protecting the patch from moisture and damage. Then comes the drug reservoir or matrix layer. This is where the magic happens. It contains the anesthetic agent, meticulously formulated for controlled, extended release. But we can't forget the controlled release membrane, which acts like a gatekeeper, controlling the speed at which the drug is released. And the adhesive layer, like a trusty sidekick, keeps the patch securely attached to your skin, even during your victory dance. Span class equals QL cursor/span. Lastly, the liner or release liner, which is like the final curtain before the show begins. It's removed before applying the patch. Let's meet the stars of our show, the anesthetic agents that go into these patches. Each one has its unique strengths and characteristics. First up, we have lidocaine, making its debut in 1948. It comes in various strengths, offering relief within an hour. Then, there's diclofenac, introduced in 1984. It's available in different strengths and can kick in within hours. Clonidine, hitting the scene in 1982, offers a calming effect and is available in various strengths, making it a great addition to the anesthesia toolkit. Don't forget buprenorphine, introduced in 1978. It's your steady companion, providing gradual pain relief over several days. And last but not least, fentanyl, from the 1960s. It's like the marathon runner, slowly reaching its peak effect over a couple of days. Well, that's a wrap for today's episode. We hope you've enjoyed this journey through the world of transdermal patches in anesthesia. Remember, these patches aren't just stickers, they're precision instruments in the art of pain management. And if you ever find yourself with one of these patches on your skin, you'll know exactly what's going on underneath. Thank you for tuning into Optimal Anesthesia. Stay curious, stay healthy, and until next time, keep exploring the incredible world of anesthesia.